Okay, Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I'm Shaza Elamin. I'm a fourth year medical student in Queens. And like Rayyan, I had the opportunity last year to do a master's in public health in the middle of my undergraduate training. And what's worrying about breast cancer is the proportion of women that present with late-stage disease. So for those who don't know, cancers are staged from 1 to 4, stage 1 being the earliest stage of the disease and stage 4 being the last stage, by which stage the cancer has gotten larger and has spread to different parts of the body. And you can imagine by the time someone gets a stage 4 disease, it's harder, it's more difficult to treat, the patient suffers more, and most importantly, their survival is associated with it is much lower. And also, in terms of resources, it's much more expensive to treat late-stage disease than it is to treat early-stage disease, and it consumes a lot more resources. So in Sudan, it's estimated that approximately 80% of women initially come with stage 3 and 4 disease, and only about 5% come with stage 1. Now, this is just estimates because this is just from the literature. And so we have a clear issue here with late detection and late presentation in Sudan. So how do we control this? Well, the two main ideas behind cancer control are prevention and early detection. So with regards to prevention, there's a number of risk factors that have been identified for breast cancer. So things like lifestyle factors, diet, obesity, some medications, and also things like no breastfeeding are associated with breast cancer. But breast cancer isn't a disease that's entirely preventable because of the genetic influences on risk. So the mainstay behind breast cancer control is actually early detection, increasing the number of people that we're detecting in stage 1 and stage 2 disease, and decreasing the number of people that are progressing to stage 4. So with regards to early detection, there's a number of things that we need to consider in order to achieve it. The first thing is awareness. So people need to be aware of breast cancer, they need to be aware of its signs and symptoms, they need to be aware of the importance of early presentation and early detection and not ignoring their symptoms. So currently in Sudan, there's a great lack of awareness with regards to cancer. So there's a number of ways in which this can be improved, and developing from what Dr. Miyada was talking about earlier, the whole systems approach, the idea that health is not just the responsibility of the healthcare sector. So other sectors could play a role in promoting health in terms of breast cancer and increasing awareness. So things like the education sector, including it in school curricula, and also telecommunications, like we were talking about earlier, could play a vital role in sending those messages to the public about early detection and early presentation. The second thing is screening. So screening is basically where you have a group of people who are at risk of a disease, and they're checked every few years to see if they're developing any signs or symptoms of the disease. And there's a number of different methods that can be used for screening. And one of the most widely employed methods in the developed world is mammography, which essentially is like an X-ray for the breast to view it to see if there's any changes within it that could potentially be cancerous. And we see that mammography is effective in the developed world. We see that it's effective in early detection, and we know that we have an issue with late presentation in Sudan. So the question is, should we have mammography in Sudan? And this was actually the area that I researched last year. And I found that there was a number of different factors that would suggest that possibly mammography may not be the best option for Sudan in this moment in time. So things like the obvious one, cost. Mammography is very costly and not compatible with the current expenditure in health in Sudan. Second thing would be resources. It's very resource intensive, and I don't mean just the machines itself. People need to run the machines, you need staff, but also maintenance in order to sustain it as a screening program, screening method. And also there was a number of other factors, for example, the age at which women in Sudan suffer from breast cancer. We in Sudan get breast cancer almost a decade younger than women from Western countries. And mammography isn't a method that's effective for younger women because the breast tissue is denser, which is why in countries such as the UK, women don't get screened below the age of 50. So putting all those different factors together, it suggests that mammography may not actually be the best example for Sudan in this moment in time. So this is an example of not everything that works in the West will work in Sudan. We can't just look at what other countries are doing and then just try and mirror that into into our country. We need to adopt prevention strategies that are compatible with our resource levels, that suit our populations, and that will be successful. So alternatives to mammography for screening would be breast self-examination. This is basically where the women self-examine their breasts, and if they notice anything, then they'll need to be referred for treatment. Or clinical breast examination, where someone who is trained to examine the breast will then conduct that examination. And there was actually like a pilot screening program in Jazeera, where they trained local volunteers to examine women's breasts, and then they went around the village and they examined the women in the village to see if anybody is showing any signs or symptoms of breast cancer. And the results of that study was actually really promising, and it showed that they detected a number of women with late-stage disease that then went on to have treatment, and they were successfully treated. So it suggests that be a breast self-examination or clinical breast examination could actually work for early detection in Sudan. And what I particularly liked about this method was that it was practical through its use of local resources, and not trying to bring in new machines or trying to use something that it's far-fetched for our level. So I've talked about awareness and I've talked about screening for early detection, but controlling breast cancer doesn't end here. If there's cancer suspected through screening or through awareness, those people need to be diagnosed. Once people are diagnosed, then they then need to be treated, and once people are treated, they have to be followed up. So there's a number of issues with regards to each of these steps. And this is building on the whole idea of you need to think of it as a whole system. You can't just think of awareness and that's it, and early detection. Those people who are detected early then have to be treated. So with diagnosis, the diagnosis of cancer usually requires some form of imaging or a biopsy. And currently in Sudan, there are resource shortages, particularly with histopathology services and the human resources that are related to that service. So here we have resource shortages that are delaying treatment, and we know that late treatment is associated with worse outcomes. Also for treatment is arguably the most important step in this pathway, because it's not early detection as such that saves lives, but it's actually early treatment. The whole point.
People from the Facebook ask you to speak up.
Oh, sorry.
People globally watching you.
Sorry.
So
what was I talking about?
Yes,
the early treatment. Yes.
They're enjoying your talk.
Okay, thank you. So yes, it's not early detection as such that saves lives, but it's actually early treatment. And there's a number of issues with regards to treatment now in this step in Sudan. So one of the issues is actually accessibility. In Sudan, there's two main cancer centers that are used for managing cancer. So there is Zerra Hospital in Khartoum, and there is the National Cancer Institute in Jazeera. And both those cancer centers are located in close proximity to each other. They're located less than 200 kilometers apart. So there's a clear inequitable access for those who don't live in those areas of Sudan. And also with regards to the infrastructure that's required for treatment, I'm just going to use radiotherapy as an example. So radiotherapy is a common modality that's used for treatment of many types of cancers, of which one of them is breast. And in Sudan, there's a shortage in radiotherapy, and there was an organization called the International Atomic Energy Agency, and they actually did a assessment of the capacity of radiotherapy in Sudan. And they give a recommendation that for developing countries, for every 500 patients with cancer, there should be one radiotherapy machine. And given the estimated number of cancer cases that we have in Sudan, there should be, I think there should be 16, as far as I'm aware. But currently we have around 3 or 4. So there's a clear imbalance of what we should have and what we do have. So again, resource shortages leading to delay in treatment, and there will obviously be a clear backlog if there's not enough. If you think there's not enough treatment, there's going to be many people like a long waiting list and long backlogs. So those are just some of the issues that are associated with the diagnosis and the treatment stage. And I'm aware the time is tight, so I'm just going to wrap up here. And so we've just in conclusion, we know that breast cancer is an important issue in Sudan, of which the most important issue is late presentation and late detection. We know that we need to raise awareness, and we need to think of ways to deliver the message effectively to the population. And we need to consider a screening method that's effective, that suits our resource levels, that suits our populations. But most importantly, we need to consider the resource issues with the diagnosis and the treatment stage. And that's all I have to say. Thank you very much for listening.
We're very proud of this. Just a quick question. Some people would ask, do you have any specific statistic how many millions, thousands we have, really?
In Sudan of
yes,
breast
Sudan.
cancer?
Yes.
There are statistics that are available, but
numbers
the
like
issue,
what?
Probably millions, or thousands or millions, I'd say.
And these are from Sudan or from like a WHO?
Sorry, there's statistics from the WHO and there's statistics from papers, but the issue is that because there is a cancer registry in Sudan that collects data for cancer, but it's not complete. It doesn't cover the entire country.
Because you said because of the situation in Sudan, awareness is very important.
Yeah.
And also given the level of education, we are very low in our education, and so the awareness is very important. Do you think if we design a very simple message, then it can be transformed into an app, a small app? So because in Sudan they are, like Basma said, obsessed with WhatsApp and everything.
Yeah.
Can an app be an option to produce a small app to educate people in villages, farmers, women, how they test themselves?
That could be an option, but I'm not sure if people will actually go to download it. But I think we can use what we already have, like WhatsApp, and I don't know if other people
For example, there might be some WhatsApp people can...
Yeah, like I don't know if other people saw there was like a cholera video that was going around to raise awareness about cholera and how to prevent it. That was really effective, and it would spread virally.
Okay, so we can
I think we can use
to raise awareness.